When thinking of ideal results of improving our health, we may imagine becoming stronger, smarter, healthier, more resistant to disease, age-resistant, slimmer, with great skin and strong bones. While it may seem like a big ask, it is entirely possible with supplementing vitamin D. Vitamin D deficiency and insufficiency is incredibly common worldwide. Estimates from the Cleveland Clinic say that 1 billion people worldwide are vitamin D deficient, and 50% of the population is vitamin D insufficient. Outside of fish, egg yolks, mushrooms, and cod liver oil, the only other natural source of vitamin D is the sun, but with concerns of skin cancer and an increased amount of people staying indoors, making sure you get enough vitamin D can be difficult. Being certain your vitamin D levels are sufficient has major positive effects on your health in the following ways. 1. Vitamin D controls blood sugar and helps insulin levels. Type 2 diabetes has been associated with vitamin D deficiency. Researchers in Tehran, Iran, did a randomized controlled study to find the effect of vitamin D supplementation on glucose control and insulin resistance. The researchers found that vitamin D supplementation benefits glucose homeostasis and can make type 2 diabetic patients more insulin sensitive. Other studies have shown that vitamin D deficiency may also increase risk of developing both type 1 and type 2 diabetes. Though the mechanisms of how vitamin D affects glucose control and insulin resistance are not well understood, vitamin D supplementation may help prevent developing diabetes and make living with diabetes easier. 2. Vitamin D subdues back pain. It is estimated that 80% to 90% of people in the United States will have back pain at some point in their lives. While we may think of back pain as inevitable, vitamin D has been found to potentially prevent back pain. Researchers from Saladin Diyarbakir State Hospital in Turkey found a correlation between low vitamin D levels and worse pain severity in patients with low back pain. Lack of vitamin D was also attributed to a decrease in muscle strength of the waist, back, and neck. 3. Vitamin D protects your teeth. You may think that the key to a healthy smile is a good brushing and flossing habit, and avoiding sugary foods that cause tooth decay. Vitamin D can make a major difference in how healthy your teeth are. Healthy levels of vitamin D make your teeth strong and durable. Lower levels make you more susceptible to cavities, fractures, and tooth decay, as well as gum infection and inflammation. Being positive you are vitamin D sufficient means less stress at your next dentist appointment. 4. The vitamin they give to intensive care patients. Vitamin D is related to immune response, which means making sure you are sufficient can help prevent infections. In the case of intensive care patients, or people who are in the hospital for extended periods of time, it can be harder to be certain if you are getting enough vitamin D. At Honggang Sacred Heart Hospital in South Korea, researchers found that vitamin D supplementation provided positive effects for infectious disease on neurosurgical intensive care unit patients. They concluded that vitamin D sufficiency correlated with higher rates of survivability and recovery. 5. Vitamin D supplies more energy. Symptoms of vitamin D deficiency and insufficiency include fatigue and poor sleep quality, with other symptoms that exacerbate fatigue, like chronic aches, muscle weakness, and low mood. It is no wonder that researchers from the University of Zurich in Switzerland found a positive correlation between energy level and vitamin D supplementation. Researchers stated, "Our results showed that vitamin D treatment led to a significant improvement in the vitamin D group compared with the placebo group. Moreover, improvement in fatigue modestly but significantly correlated with the change in vitamin D levels among all participants." 6. The vitamin that reduces fibroid risk. Fibroids are non-cancerous tumors of the uterus that can cause pelvic pain and irregular menstrual cycles. They vary in size and severity, and though not all fibroids cause discomfort, some may have to take medications for relief or have surgery to remove them. Medical studies found that vitamin D deficiency correlated with a higher occurrence of uterine fibroids. Another study found that not only did vitamin D supplementation help prevent the growth of fibroids, but also made fibroids shrink. 7. Vitamin D protects from dementia and Alzheimer's. Researchers found in an elderly population of 658 who participated in a cardiovascular health study that upon follow-up approximately 5 years later, 171 participants that were vitamin D deficient developed all-cause dementia or Alzheimer's disease. Those with a vitamin D deficiency were said to have a 51% higher risk of developing all-cause dementia, and those with a severe deficiency had a massive increased risk at 122%. The researchers wrote, "Our findings support the hypothesis that vitamin D may be neuroprotective." 8. Improving cancer outcomes. According to the National Cancer Institute, vitamin D has been associated with reduced risks of specifically colorectal cancer and bladder cancer. In cases of mortality in cancer patients, observational studies have found vitamin D deficiency has been correlated with higher mortality rates. While research is still in incredibly early stages, researchers from Harvard concluded what the study findings do suggest is that people who may be at high risk for cancer because of family history or other factors, as well as those with a previously diagnosed cancer, should be particularly vigilant about avoiding vitamin D deficiency. How much vitamin D is enough? With benefits of better skin, stronger bones, a stronger immunity, and better outlooks for your health while aging, vitamin D is necessary to keep us healthy. Most people get their vitamin D from 3 primary sources. Your skin gets vitamin D in response to sunlight exposure. Your foods can provide vitamin D if you consume oily fish, and vitamin D supplements can also supply the vitamin. The recommended dietary dose for people age 1 to 70 is 600 international units. For people over the age of 70, the recommended dose is 800 international units. Doses may be higher if you are vitamin D insufficient or vitamin D deficient. Unless your doctor recommends a higher dose, the highest dose is 4,000 IU a day. Make sure to look up any drug interactions if you take medication before starting vitamin D supplementation. Make sure your vitamin D supplement is natural vitamin D3, cholecalciferol, and not synthetic vitamin D2, ergocalciferol. Vitamin D3 has been found to be more efficient at providing increased levels than vitamin D2. Thank you for watching. If you liked this video, click the like button, and if you want to see more videos like this one, click subscribe.